Good evening, Scleroderma family. Good evening, Dr. Shreya. Thank you for being with us on a Saturday evening. Really obliged to have you. Small introduction on Dr. Shreya. Dr. Shreya Gada is a very MPT neurophysiotherapist. She is practicing from Mumbai. Dr. Zaveri is a Mumbai-based neurophysiotherapist with 8 year plus of experience in treating pediatric, adult, and generic patients. A graduate and postgraduate from KM Hospital, she ranked 13 in the Maharashtra PG entrance and secured a government seat in neurophysiotherapy. She was also a bronze medalist under MUHS. She has worked with Sir H.N. Reliance Foundation Hospital, gaining hands-on experience. During COVID-19, she took on to virtual neurophysiotherapy sessions. Today, she runs her own clinic in Ville Parla West and offers home visits as well. Today, Dr. Shreya will be talking about how to incorporate movement in easy and fun way so that it's not boring for people to exercise or they have one extra reason not to exercise. Over to you, Dr. Shreya.
Hello, thank you so much for inviting me over here to Scleroderma India, to Ms. Rashmi. Thank you for this platform. Also, with a fun way, I'd like to even introduce physiotherapy as a whole and occupational therapy a little bit into scleroderma treatment. You all will get it slide by slide when we go through with the PPT. And in the end, we can have some questions if you all have anything pertaining to physiotherapy in it. All right. I will try to do justice to scleroderma as a whole. It is a vast topic. Even if it's rare, it is vast. And like there are so many challenges that you guys face that I'm really proud of all of y'all. I'm going to try to just give 1% input to your phases so that it helps you all. Even if you'll take one pointer from this, I'll be very happy. Let's begin. Handle your physical challenges, a physio perspective. Uh, that's it. Yeah, it did go. Also, I'd like to thank my husband for making this beautiful PPT. The matter is mine, the editing is his. So you all can tell him that. Okay, I need to shift this a little bit. Yeah, this is, I'm sorry, I'm technologically challenged. Okay. Systemic sclerosis or scleroderma. We know it's two types, localized and systemic sclerosis. So I'm not going to go into details of it. All right. But in localized, we know that it primarily affects the skin and the subcutaneous tissues. While in systemic, it is not only limited to skin, but also affects the internal organs. Okay. I'm trying to pick the word. Rashmi, okay. Etiology can be genetic factors and environmental factors. Prevalence is 24 people amongst 100,000. Unfortunately, females are more affected than males, 5:1 ratio. The peak onset is middle age. We know it's a multidisciplinary approach, but when I go through a lot of slides and a lot of matter which comes online, we know it's rheumat, pulmonologist, dermatologist, gastroenterologist, cardiologist, radiologist, nephrologist, gynac, and psychologist. But I want to put forward the physiotherapy point of view, which can help at least relieve your pain or improve your symptoms or prevent those symptoms from occurring to a larger extent. And that is why I'm going to give you certain ideas for doing it today. Today is going to be more of a very systematic approach, and at the end, I'm going to tell you all verbally fun things which you all can do to get it done.
Dr. Shreya, sorry, I'm interrupting you. Your voice is a bit feeble. Can you just be a bit louder or adjust your volume?
So, adjusting my volume, you will have to help me with that. Okay, is this volume okay? Is this okay?
Is it audible to everybody, guys? Can somebody unmute Lata?
Yes, it's audible.
Okay, great. Please go ahead.
Okay. The Today it's not about what you have. Today I'm going to talk generally. So there'll be certain signs and symptoms which you might have and certain which someone else or your friend might have. These are some of them, and these are only physical ones which I'm talking about. That is stiffness and joint pain which causes due to inflammation. There's pain, thickening of the skin, callosities, ulcers, painful bumps. You can have muscle weakness, fatigue, and there's destructive lighting changes which happen in your tips of the fingers. The emotional part also gets collaborated with physio, because if you want to move, you need to be focused about it. So your stress, anxiety, and depression also could pull you down to not do those things, right? And also, if you do physical activity, it is possible that your stress, anxiety, depression comes down. So it is simultaneous. Work on one, the other will work as well. Treatment, we need early diagnosis. There's an article which I read in which a person got diagnosed so late that all the signs and symptoms and all came really fast, and unfortunately things got damaged really well fast. So awareness creation is very important, and even with doctors, whoever feels certain things, they should go to the doctor immediately so that the treatment can be started. Maintain a healthy weight, stay active, quit smoking. Engage in low impact exercises. I understand that distal extremities and ulcers and stiffness, thick skin, all of them prevent you from moving. But if you do low impact activities like walking, or there are these stationary cycles which you get at home itself, where you put them against a wall and then you do upper limb cycling and lower limb cycling. That moves your muscles, it moves all the joints. It is non-weight bearing. So the pressure which happens because of putting weight on your knees or ankles or toes, okay, that is reduced. Also, it works on your upper limbs as well. So you can move the upper body quite easily. It improves blood flow. Any form of exercise improves blood flow, so that the circulatory damage which you get due to Raynaud's or reduced circulation, it reduces. What works best for one person wouldn't work well for the other. So do not compare yourself. Since these pictures are self-explanatory, but the first one on the in the center with the balls, that's an incentive spirometer. That's a very fun way to work. If all of you all are in a team, you all are in a meeting or something. What you all can do is keep your spirometer, keep it in, and have a match kind of thing, have a competition. Okay, who's gonna blow it higher and harder? So one ball comes up, the second ball comes up, then the third ball comes up. You all can have this competition every month, right? And so that everyone will practice the entire month. Imagine everyone doing these exercises, like blowing into the ball and increasing their lung capacity, so that during the competition they perform well. Don't you think it's a fun idea? Right? The another one is balloon bladder. So there's a balloon in which you just blow air. That's expiratory. Now, if I have to do breathing exercises all the time, I myself can't focus. But if I have the ball, I can do it quite easily. There's a target which I have to look at, and it moves. Right? So I know, okay, आज तक yellow चल रहा था ऊपर, उसके बाद अभी red भी आ रहा है, उसके बाद white भी आ रहा है. So it's helpful. Balloons, the competition can be like there can be 10 balloons placed on the table, and you pick up, you blow it, not nahi karna, sirf blow it and put it sideways. Pick up, blow it, put it sideways, right? Whoever finishes the 10 once is a winner. So that way you all will have expiratory capacity. But plus, when the balloon expands, it gives you resistance, right? So the lungs have to push harder to get the air out. I think it's a fun way to do it. Those who have issues with the fingers, that's obvious. There's something called as a balloon bladder that has a rod in front and a football balloon later. So all you have to do is hold it. You don't have to hold it like a balloon, you just hold it and then you breathe out. It's a good way. Meditation and relaxation techniques are also used. Now, the point of asking one of y'all on how y'all want to work on, what did y'all work on in those 8 months when you had the pain? I don't know your condition, right? I don't know what exactly is pertaining to you. But there are these certain tips which I'd like to give In case you use them and you feel better, that'll be good. So, stretching is something which everyone should do, irrespective of what you will have. I have recent advances later on which say advantages about stretching. Stretching should be done 10 to 15 seconds and thrice. Do all the muscle stretching. Strengthening, okay, that also that improves your function, improves the muscle control. Your activities are better. What happens is because of pain, anywhere pain, all right, the muscle weakens. Muscle has 5 levels. Because of pain, one level goes down. Then you don't use it, the second level goes down. Then again, there's some injury or some tiredness, the third level goes down. Getting it back from level 2 to level 5 gets very difficult. So keep using the muscles irrespective. Now, if you feel that you have swollen fingers and pain in the digits, it's not necessary you have to hold a dumbbell all the time. There are these, I can double hear myself. Yeah. There are these weight cuffs which you wear. So there is no need to hold any dumbbell or any object in your hand. You put the weight cuff over here and then you exercise. That means आपका exercise चलता रहेगा. You can work on your upper back, mid back, low back, your legs, everything with those exercise dumbbells. Then there are therabands and loops, which you have to just tie and then you use it for your arms, for your legs. So my point is that if one segment gets affected due to inflammation and it requires rest, don't rest overall to the entire body. Use different activities to rest better. Balance and proprioception, gait. These are very important things. Me being a neurophysiotherapist, I see neuro in everything, right? So when a joint is affected, this is the joint, right? Suppose this is one joint, finger लो, knee लो, कुछ भी लो, okay? There's swelling, उसका movement कम हो जाएगा. Movement कम होगा, so the ligaments which gives a signal to the brain, okay, that this is the position of the joint, this is straight, this is bent, that signaling goes wrong. Okay, once the signaling goes wrong, what will you do? You will not understand. So, while getting downstairs or climbing upstairs, crossing obstacles, everything will be a challenge. So, what will you do? If it's a challenge, you don't do it. Okay, you don't do it again. For example, in India and Mumbai, it rains so much. You will not go down in the rains. What will you not do? 4 months you'll be homebound. 4 months you'll be homebound. So you're restricted activities, no walking, no going for subsi, nothing doing, right? So overall, sorry, yeah. So overall, the entire capacity reduces. We don't want to do that. So you should at least work on your balance and gait during this thing. Now, heat therapy. Heat can be dry heat or it can be moist heat. If you have injuries in your area where you want pain relief, you use dry heat. All right. And if it is non injured, but you know there is some pain, there's no open wound in it, then you immerse your hands or legs in moist water, mild temperature for 15-20 minutes, you'll feel better. Orthotics is also used. Okay, one question. Anyone knows anything of these? Rashmi, you're not allowed to answer. Lata, Vinita, do you all know anything? Any of these? Right? Sorry, my bad.
No.
No? Okay. The first one is a balance pad, which is on your left. This is soft in texture. So what happens? It helps you in balance activities. Now, when you're standing, do you feel confident? Lata, since you answered, I'll ask you this question. When you're walking on uneven surfaces on Mumbai roads, which are dug all the time, do you feel confident?
No.
No, right? It is possible because of the feet or the ankle, the knee, hip, overall anything in pain. So what happens is we have to train our brain that irrespective of all the challenges which I have on the floor, okay, it can be roads or it can be my house floor where there are kids around with toys put down. I am able to maneuver myself without falling, right? So balance pad ka ghar ka replacement is a pillow. It's very simple. Put the pillow, stand on the pillow, keep a chair in front of you. All right. So when you're standing on a pillow, keeping a chair in front of you, you know you're not going to fall. But you know that your balance is getting, sambhalod. You're not going to fall and you're training your balance. Then you slowly move the pillow away. So this is a chair, all right? And I'm going to stand on a pillow and hold the chair. I can leave the chair and stand on the pillow, balance myself. I can do activities like heel raises, standing on one leg, doing catch and throw activities while standing on one leg. All these things improve balance. If you need more exercises on all, I can suggest later on. Next is tilt table. The tilt table moves left and right. So it's like traveling in a train. The train obviously doesn't tilt, but the train moves left and right? So you need to balance yourself in that as well. So it works on your core, on your sides. It's a fun way to do activities. I don't like the traditional way where you just have to do those certain movements to get yourself better. Next is walking over obstacles. It's very easy to do. You put your bottles or put something or the other which is obstacle kind in your hall and you cross it. It's like रास्ते पे अगर पत्थर रहेगा बड़ा वाला आपको क्रॉस करना है तो आप कैसे करोगे वैसा, right? And do alternate legs, do side crossing, don't do back crossing, very dangerous. The next is foam wedge. You know what happens with a foam wedge? Do you all see the incline which it is in? Okay, it's a very good way to stretch your calf muscles. So, since it's an incline, the calf is getting stretched, but your fingers are relaxed. Do you all observe that? So, it improves the ankle range of motion. Now, since it's like this, the ankle it's stiff because of swelling or whatever. When it's painful, when it's inflamed, do not stretch the joint. Okay, but when you're in remission phase, when inflammation has settled and you're a little better than what you want, you will have to improve the range of motion. Otherwise, the skin gets tight. Ankle movement 10 degrees upwards and 20 degrees downwards. Total 30 degrees is very important for walking. Walking is very important for our overall movement, right? Because we need to reach somewhere, we need to go to the work, we need to do anything, we need walking. For that, we need ankle movement. Foam wedges are very important way. All you have to do is either either purchase a foam which is wedge shaped or take a table which is like this. Do you all know parking slopes? They sometimes are like upwards, right? Just stand facing upwards. You'll stretch your calf muscles. Next, you'll see me. Okay, for this, whoever's comfortable, we could open the video so that you all can follow my instructions, maybe understand how to do these face exercises quickly. Whoever's comfortable. Lata's here. She's given me her approval from first, right? Vinita, Mr. Vijay, anyone. Okay, would you all like to do these exercises with me so that you'll understand it better? Or do you all want me to just show it just like that? Okay, no problem. I'm going to show it just like that. Now, uh, face is one of the things which gets stiff, right? And we want it to move. But how do we move it? We use expressions. The first expression would be pull the eyebrows up, like you're asking someone, "Kya hua yaar?" Yes, Yata. Lata's asking me, "Kya hua?" She's smiling also, nice. Okay. So this is one. There are very many people who can do that Kathak thing, 111. I can't do it, sorry. So I can't explain you all that thing. Okay? She's trying that one thing. Okay. So that's the first one, which is like kya hua. Yeah. The next one is tension. Get your eyebrows close to each other. Tension. Yeah. Okay. Now next is अगर गंदी बात आई ना वो कचरे का डिब्बा नीचे से लेके जाते हैं तो हम क्या करते हैं Gandhi bus. Look at the screen, everyone. Try it by yourself. Even if your screen is off, it's fine. Gandhi bus. Take this up. बहुत गंदी बास आ रही है. Up. Pull with your fingers if needed. Pull it up. Yeah. Yeah. नाउ नेक्स्ट, आंख मारनी है. अगर आपका स्पाउस साथ में है तो उसको आंख मारो. I can't do the right one alone. It's very weird. और फिर alternate आंख मारो. If you observe when I'm doing alternate आंख मारो, my cheek is also going up and down. So don't you feel that the skin is gliding up and down? So ये automatically हो रहा है. You know, the face is getting. आंख मारनी है. Obviously हम दोनों आंख से साथ में भी आंख मार सकते हैं, लेकिन ये बहुत weird लगता है. ठीक है? So we've moved the muscles of the upper face. Now the lower face. Very important one. Smile. Nice. Can you see he's going up nicely? Okay. Next is ooh. You have to pout or kiss your spouse, kiss your kid, whoever you want to. So it goes like, it stretches this muscle. Face has a very big representation in the brain. Why? Because we have these small, small muscles which move beautifully. And if we move it, पहले स्किन है, नीचे मसल है, हम मसल मूव करेंगे तो क्या लगता है आपको, स्किन मूव होगा कि नहीं? होगा ही ना. और उसके बीच में कोलेजन है जो कल्प्रेट है स्क्लेरोडर्मा का. तो अगर हम मसल मूव कर रहे हैं, हम स्किन मूव कर रहे हैं, तो कोलेजन भी मूव होगा, फ्लेक्सिबिलिटी रहेगा. ओके. स्माइल हुआ. नाउ ब्लो अ बलून और गार्गल इन योर माउथ. And what I do is when patients come in the clinic and when they're gargling now, I just burst it. Automatically smile का exercise हो जाता है. Gargle, gargle. Nice. Can you feel the air going left and right? Feel the flexibility in your mouth. All right. Now next is like eating a very big laddu, okay, in your mouth. Eat a laddu. Ah. Or golgappa, pani puri sort. You know, there are these big, big puchkas which people eat. इधर मुंबई में तो हम पानी पूरी बोलते हैं, तो उसके लिए बहुत बड़ा वाला आ. Now what we're doing with this, you know, we're stretching this. Those like those who have cuts over here or scars, I understand it'll be a little painful. Apply a little moisturizer first and then open it. After you do it a particular number of times every day, this will open up, right? The talking will be better. Ah, all right. Chewing will be better because these joints move. If you put your hands here now, you will feel these joints are moving. Just below the ear is the TM joint. So that moves. Okay. हमने ये पूरे को कर लिया, right? And now to use your lung capacity, what you can do is, please close your ears if it's too loud for you. Ha, ha, ha. You're like removing air from your mouth by laughing out loudly. All right. It Laughing is something which gives good endorphins and enkephalins, good hormones in your body. Okay, so irrespective of however your day is, it is good to laugh, right? Sorry, I need specs to continue with the PPT. So taking a break. फेस एक्सरसाइजेस मूवमेंट किया और फेस को मसाज भी करने का अपवर्ड डायरेक्शन में, डाउन टू अप, एवरीवेयर, on your cheeks, on your nose, up. और अच्छे से मॉइस्चराइजर लगा के ऐसे मूव मूव करने का. You will feel that the face is softer, you know, and move it faster sometimes. Good sensation for your face. Move it faster. All right. Face massage is very important. Face movements are very important. Jaw movements are very important. Neck stretch is very important. The side stretch. The muscles relax on one side and then the other. Overall, it improves the flexibility of the muscles. Yes. If you use your hand towards the opposite direction, it is going to stretch your neck nicely on one side. That's right. Can you feel a stretch on the side of your neck? And hold for 10 counts and then relax. Do it 2 to 3 times. You'll feel better, you know. Stiffness will reduce. Next, to just create a little awareness about the feet, right? Use wide toes, toe boxes. Shoes होता है ना, उसका आगे का पार्ट को toe box बोलते हैं. Wide toe boxes. There are certain diabetic footwear which are available in the market. You can use those. They are softer on softer soles. All right. So आपके blisters, ulcers, injuries, callosities, आपको जो भी डिफिकल्टी है फुट में वो कंट्रोल में आता है. Right? If you don't want to purchase those diabetic foods, online Amazon may there are these silicone heels. You all can take a screenshot or photo of these slides so that use it whenever required to understand. Silicone heels आते हैं, silicone surfaces आते हैं. That is also soft for your feet. Wear these footwears while exercising as well, so that आपको जो pressure changes आता है exercise में वो नहीं आएगा. Use sandals with velcro, don't use elastic ones because elastic वो friction आता है skin पे constantly, then it creates a mark. Sandals रहता है so you can stick it anytime you want. Next, foot care, very important slide.
Just a small question here, because this is going to come when you're talking about footwear. A lot of
Yeah,
people have ulcers on the sole of their feet, right?
yeah,
Down on the thumb or
yeah,
maybe towards the heel.
yeah,
And most because of the friction, the ulcer will not even get better, and there'll be a wound, or maybe amputation comes into play because gangrene starts forming in. So,
yeah.
what sort of footwear will
I'll
this kind of
explain.
footwear help?
I'll explain. So imagine this is a foot and not the phone. All right. Can you see these holes in the phone? Right? In your footwear, you need to go to a special orthotic, right, to get your footwear better. सोल रहता है ना आपका फुटवेयर में ऐसे वाला, उसमें इधर छेद बना देते हैं वो लोग जहां पे आपका अल्सर है. So it's like a tunnel, a bowl sort of thing where your foot is contacting all other parts of the shoe, but the injured part is not getting contact. Okay, so the ulcer has breathing space, and these diabetic footwear na, Rashmi, they are very good for handling the pressure changes. तो अगर अल्सर्स नहीं हुआ, अल्सर प्रिवेंट करना है तो आप डायबिटिक फुटवेयर यूज करो बिकॉज दे आर सॉफ्टर. द नॉर्मल फुटवेयर विच वी हैव, तुम कोई भी ब्रांड ले लो, स्केचर्स, एसिक्स, वो लोग बोलते हैं सॉफ्ट है पर इतना सॉफ्ट नहीं रहता है. ओके, एंड दोज हु हैव अल्सर्स, प्लीज मेक श्योर दैट यू ऑल हैव दोज बारो टाइप्स. ऑर्थोटिक के पास जाओ, उसको बोलो ऐसा छेद वाला मुझे सोल बना के दो ताकि अगर मेरा पैरा ऐसा रहे तो वहां पे गैप रहे, सो देयर इज ब्रीदिंग स्पेस. Also, in these ulcer kinds now, try changing, वो आगे में आएगा, 1 second, here. So inspection of the foot is very important for those who already have it. Okay, we have to take precautions to prevent gangrene. For those who've not got injured, please keep a track of not getting injured. This is very important. Take a hand mirror and check your feet every day कि आपको कोई वहां पे इंजरी, कट, callosity, ऐसा कड़क वाला sensation नहीं आया. Your fingers are, press your fingers slightly and see whether there is good circulation in your finger. अगर आप press करते हो वो white से फिर red हो जाता है, white से red हो जाता है, that is good circulation. Every night you all should check it. The way to avoid ulcers is keep a track of ulcers. अगर कुछ भी ऐसा लगा तुरंत डॉक्टर के पास जाओ and orthotic के पास जाओ to modify your footwear so that you are able to do your functions well. Rashmi, is the answer, like, did you get a good answer?
Yeah, actually, again, because it's going to come back to you in the session later. A lot of patients here, they have unhealed ulcers which are there from like last 10 years, 8 years, and they're not healing because of the friction. And what you're
Yeah,
talking about, you'll have to give them a better explanation later in your session,
definitely.
because I'm not sure how much they've understood. Plus, since we are just here, so there's one lady, she's asking, Vaibhavi is asking that, whatever brands you're giving out, they're expensive. Can you give them a reasonable brand as possible, please?
So that's what I'm trying to tell you, that whatever expensive brands also you take, I wear only Skechers, right? But diabetic footwear come at 1500 cost, 1500 or 2000 it cost. Okay, for those who don't have ulcers. For those who already have ulcers, you will have to go to an orthotic who will do that specialization of the footwear. Okay, the physio can suggest an orthotic to go to, that आप यहाँ पे जाओ और वो करा के आओ, but the changes in the footwear are done by the orthotic itself, not us. Okay,
Thank you.
yeah, no problem. Avoid walking bare feet. Keep changing your socks. Okay, wear very thin socks, but keep changing them. If For those who have ulcers, I understand that it might be open, unhealed. Don't keep your feet very open, but you need to keep changing your footwear. Footwear in the sense, अगर आपने shoes 3-4 घंटे पहने when you're going out somewhere and you're out for the entire day. After 4 hours, remove your shoes, let the foot breathe. Inspect your foot again, and then again wear your shoes. You need to take time off. You can't constantly wear a footwear for 12 hours, even if it's a specialized footwear. Okay, you need to give some breathing space. Switch to comfortable slippers at home. Don't walk bare feet at home as well, but outside, obviously, close it. Foot massage is a very good option to stimulate circulation and relieve tension. Also, just in case, if you all want to try ozone therapy, okay, since Rashmi asked me about these ulcers which are not healing, वहाँ पे circulation reduce हो जाता है, infection आता है, बहुत सारे chances होते हैं because of it's not healing, right? But in more like in people who have literally got uh, no skin and infections and all in all other parts of the body, ozone has helped a lot in creating good tissue, good tissue up, and then they do a skin graft later. So ozone therapy is one popular thing which can help in ulcers as well. And second is foot massage. Do not massage the ulcer. For example, okay, just imagine that this is the ulcer, right? Okay, this is the ulcer. Don't massage the ulcer, but massage around it. Take 2 fingers and massage around the ulcer. So what we're trying to do is we're increasing circulation all around ताकि ulcer तक भी पहुंचे, right? Do not take everything I am saying like word to word. Please consult your physician who is seeing you. I'm not seeing you yet, right? Someone who is seeing you, consult with them regarding ozone or whatever I am saying, and then go ahead with the idea, please. Do not just apply it because it's a generalized statement. It's not personalized right now, right? Foot massage for 10 minutes overall on the sole of the feet, between fingers, movement, all of it is very good. Check feet, wash feet daily to prevent any sort of problems with a mild soap and warm water. Okay, dry it completely. Soaking feet in warm water helps. Studies have shown that it increases circulation in the area temporarily. But if you have ulcers, do not open, like if it's open ulcers which are active, do not soak in warm water. Put dry heat on it. Cover the ulcer with a thin layer of tissue or whatever cloth is comfortable to you. आपका रुमाल handkerchief होता है, and then put dry heat on it. Don't put moist heat. Hands. Okay. So ulcers can happen due to repeated microtrauma, increased use of hands, underlying calcinosis, impaired blood flow. What I suggest is, uh, what I suggest is wear gloves when you're doing any activity which can injure your skin. Very thin gloves are okay in areas like Mumbai where it's like super hot, okay, but at least आपके skin को direct injury और trauma जो होता है वो नहीं होगा. Anyone who has Raynaud's because of which वो पूरा white हो जाता है, there's something called as heated gloves. Okay, they're available in the market. It's available on Amazon. Studies have shown that the heated gloves really help. They heat on the back area over here and improve the circulation. And जो Raynaud's का उनका effect रहता है, that the Raynaud's phase is lesser and less frequent for those who use the heated gloves than the non-heated gloves. Range of motion exercises. Okay, everyone, whoever's ready, you all want to move your fingers. Let's give 2 minutes to that. Help me out, whoever's ready. If one of you all have your video open, I'll know what all you all are doing. Otherwise, it's really weird. So, first, hand exercises are important. One, we need to move all the skin which is on the hand. We need to move the joints, right? So Stretching, I will show the photos later. Gentle passive movement, splints, and strengthening. Anyone who wants to work on a laptop or piano, you all should do this exercise, right? There's a table or something. 1 second, can you all see this table? Okay, can you see it? Okay, it's like 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, then play a piano. When you're playing a piano, all the fingers are working, there's movement, or write on a keyboard. That's one of the exercises which are really fun. I use it a lot in my new clients. The next one is pinches. So touch one finger to the thumb, okay? And then the other finger to the thumb. Keep moving it up. Do you see the movements which happen? It stimulates your brain, it moves the joints, it strengthens the muscles. A lot of activities can happen. For lumbricals, say hi, hi, hi. So the fingers are straight. Okay. This is a very important core exercise. It's like important hand exercise where you straighten your fingers and you bend it. Just straighten your fingers and bend it. Very useful. It's like hello, 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 hello. All right. The next one is counting on the tips of your fingers. Counting. Okay, then you can use these 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. That way. Keep counting. Grips and pinches. You know, this is a bottle. Hold the bottle. Okay, move it. Move it. It depends on what sort of bottle you have. You can start with an empty bottle. Okay, and once your strength gets better, you increase the water level in the bottle. Start with a wider grip, and then go to thinner objects. Okay, don't suddenly go in thinner objects. If there are injuries over here, please be careful. Wear gloves while doing these activities. If you try whatever activity you do, you have your phone in hand, and if you're passing it like this is a lumbrical grip where you're holding the phone like this with thumb ahead. Okay, sorry, thumb ahead. This is lumbrical grip. So this is also strengthening, that you have your phone and just put it like this with all the fingers up and down. Then there's one finger, second, third, and fourth. 1, 2, 3, and 4. I'm trying to give you all very easy things which you all can do at home. Okay, but keep moving your hand. Say hello like this. Don't say hello like this. Hello. So the fingers are straight, okay, and you bend them together. Hello, or like a talking dog, a puppet. Hello, hello, hello. Yes, that's nice. Very good, Lata. Okay, now, do you all know how scissors works? Now, because of the ulcers which we have, it gets difficult to hold objects, right? So, you need to take a piece of paper, okay, and just put scissors on it. Hold it like this. You see the two fingers? Just hold it in between. It will activate the muscles which are here, which help in keeping your fingers together. Okay, so keep a piece of paper, hold it. If it's easy to hold the piece of paper between your finger and thumb, try pulling it out of the finger. Yeah, between your finger and thumb. A simple, a thick piece of paper. It depends on which size you want. You can take thick or thin. Start with thicker, then put thinner. That's fine. Hold it in between. It can be on resting on the table as well, so that you start very easy. It's just about getting the fingers together. Like open, close, open, close, open, close. Right? For example, next is keyhole. Do you see this clip? Okay, I understand that there'll be ulcers, there'll be painful joints, but what you can do is pull the clip open. You see my hand? All these are very simple things at home which you should try to do it. If it's a very big clip, this means more resistance. This means 10 kgs. Okay, kapde sukhane wala clip aata hai na, that is like 2 kgs. You start with 2 kgs, then do further. All right. So these are the items which I keep in the clinic. The first one, the left ones are, most of them are decathlon on the left, where you press the rings, they're different resistance. You open, there's therapy. You see the grains in the center? Okay, you all can take chole, chana, whatever, pick and put it, pick and put it. You all might find that all these are silly things, but just think about your entire day and when was the time you picked up small objects with your hand in the entire day. If you all have picked it up, very good. If you all have not, you all should inculcate this dabba in your daily routine where you just pick and put with all your fingers. First, index finger, middle finger, ring, and little finger. Imagine how many times you put it, how many times you pick and put. That means your muscles start working over here. You won't see the difference in a day, but you will definitely see a difference in 1 month when you pick and put at least 10 times. And then these are kapde sukhane wala clip, which I've bought, and it's very useful. Pinch it, put it, pinch it, put it. There are therabands as well on the side, which you can use. Wand exercises can be done. Okay. Why splints? It is possible that many of you all might be thinking whether splints to be used or not. I personally feel it is a person to person basis. Like certain people would require splints if their hands are going into contracture very fast. Whenever there's ulcer, there is swelling in the joint, okay, and you're not able to move it. So what happens is body gives depositions in the hand. Okay, idhar hi rehne do. If you don't move it, if you move it, it's painful. If you don't move it, it is going to get stiff, right? So when you put a splint, you're giving it time to rest. So 3-4 hours a day, if you put a splint and you let it rest, that means inflammation will come down. We will do heat therapy, take medication, everything required to reduce the inflammation. Then remove the splint and do these exercises. सो क्या होगा, मूवमेंट भी रहेगा जॉइंट का, ओके, और उसको रेस्ट भी मिलेगा. बट इफ यू डोंट स्प्लिंट द एरिया, that means the area is open throughout the day. If I splint something, if you see this clip, okay, if I splint it, you see this, if I'm splinting it, it's going to stay straight throughout the, like, for those few hours which I am putting it, okay. But if I don't splint it, it will keep bending. So the end of the day, it will be this. Now from here, if I have to pull it back straight, very painful, not possible, right? Kitna bhi karo, not possible. And it's not only this joint, it's all these muscles which get stiff along with it. So what do? We splint it. अभी सिंपल स्प्लिंट, खुद का पेपर, एक पेपर लिया, उसको फोल्ड किया, ओके, उसको इधर लगा दिया. मैं स्प्लिंट का सिर्फ ये दिखा रही हूँ, ओके. बॉडी स्ट्रैप होता है जिसमें 2 स्प्लिंट ऐसे लगाते हैं और यहाँ पे बैंड लगा देते हैं. The regular splints are available in the market. I'm just showing you all what it is. So now if I kept my fingers like this for a few hours, the finger is not going to bend. So when I want to exercise, okay, I will be able to move my fingers better. Plus, if it gets stiff straight away. अगर straight रहा तो I can bend it, but bend रहा तो straightening is very difficult. All right, it will reduce pain. It helps joint movement. Also, if you all are in association, you all have a physio with around you, you all should go and learn joint mobilization from them. Okay, for feet, for hands. Mobilization में क्या होता है, वो लोग joint को ना minute reach से move करते हैं. All these joints. तो जब स्वेलिंग होता है ना, उसमें एकदम grade 1 छोटू सा मूवमेंट करते हैं, और जब स्वेलिंग नहीं होता है तब ये सब बड़ा वाला मूवमेंट करते हैं ताकि जॉइंट थोड़ा फ्लूइडी हो. It's like stretching the joint itself and not the muscles. Joint movements are very important. Passive movements can be done by the patient itself. You just have to go and learn it from your therapist. All right. Yeah. This is about hand splints, which I already mentioned, about preventing contractures, maintaining joint position, pain reduction. Okay, prolonged stretch. This is a resting splint, which is used to prevent contractures. You see it? You see how it is kept? Now, if the splint is bone because there's some activity happening in the joint, I can still use this hand to lift stuff because it's a splint. You see, I can lift the bottle. So that means I can exercise. I can do my day-to-day activity with the splint on as well. Of course, it depends on which activity you want to do, whether it's fine motor or gross. I usually take a balloon, all right, and it's blown. It's there in the house. It is roaming in the house somewhere or the other. ऐसा कुछ भी स्प्लिंट या कुछ रहा ना, फिर balloon को hit करने का. It's fun because see, if I'm hitting anywhere here and there and I'm moving around in the house, that means I'm challenging my balance. I'm working on my core. I'm using my shoulders to hit here and there. There's a big smile on my face because oh, the balloon is touching here, the balloon is touching there, right? Activities like this can be done in जैसे किटी पार्टी होता है वैसे आपका स्क्लेरोडर्मा ग्रुप है, right? So whenever you all have a get together kind of thing where you all are meeting and discussing problems, like this is a good solution, Rashmi. You all should use 10 minutes at the end where you all do. I know everything might be online, but in case there's something in person, they should, play some game together where there's balloon hitting and challenging, something physical where you'll end with a very happy note. Everyone's moved all their muscles and balanced. So with splints also you can do your function. Now, do you all see this? The pen has a gripper along, right? The gripper increases the diameter. जैसे ये बॉटल है, बॉटल का डायमीटर बहुत बड़ा है तो आई कैन होल्ड इट. अगर बॉटल का डायमीटर छोटा है, पतला है, then it is difficult for me to hold. That way, pen is very thin, it is difficult to hold, right? But if I put a spacer, I put a round thing over here which increases the grip of the pen, or you take a thicker pen grip, right? You are able to write better. Now, don't let this these ulcers restrict you. Since I'm a neuro PT, I have this client since 5 years. Right side stroke, unable to move the right side of the body. We started practicing with a left hand, writing with a left hand, drawing, sketching, everything. First, she couldn't even make a straight line. Now she writes beautifully, better than what she used to write with the right hand. Because she trained her brain to use the left hand and write better. Okay, and her one half of the body is not working since 5 years. Okay, so the left hand is now doing all the work. So जैसा भी grip आए, don't lose it. Use that grip. You see this man who is holding the pen like this. It's not a correct grip, but what is right or wrong? As long as the function is happening, do it. Okay, now this is just an example of a pen, but what you can do is take a board. Those whiteboards come where school में ऐसा होता था, chalk से भी होता था और marker pen से भी होता था. The marker pens are really huge. Okay, so what you can do is hold the marker pen and start drawing with these things, right? So what happens is the shoulder is moving because you're moving around. आपका precision better हो रहा है. You're able to communicate with your writing. किसी को letter लिखना है, कुछ भी message डालना है, आप board पे लिख सकते हो. Play X and Zero, play tic tac toe. There are like so many games which you all can play on the board. You know. Then I have a lot of videos posted on my Instagram account where you use both the hands markers to do both hand activities. It's really fun. Keep your partner samne and play a game along where you're drawing something and they are drawing something. Next one is a photo of a key holder built-in handle. So आपका ऐसा रहेगा कि आपको फाइन ग्रिप नहीं हो रहा है, चाबी नहीं घूम रहा है, right? So modify that चाबी area so that the grip is bigger. कारपेंटर को बोल के एक वुडन पीस या कुछ ऐसा बड़ा वाला लगाने का, ओके, हैंडल के ऊपर कपड़ा रोल कर देने का. फॉर एग्जाम्पल दिस इज द हैंडल, ओके, इसके ऊपर ऐसे कपड़ा रोल किया तो क्या होगा, ग्रिप बड़ा हो जाएगा. नाउ यू यूज इट. ओके, imagination, just imagine and things will be better. You see this man, all these are scleroderma pictures, by the way. So you all don't have to think that, oh, they're just doing it. This is literal real life happening. People are doing this and still working. So you see the splints, the bandages, but still the typing is happening. If you stop, like, if you just don't do anything about it, nothing's going to happen. If you think of possibilities, I'm very sure you'll be able to take one step forward, right? All these are splints. These are spacers. Okay, this is a stroke picture, but I wanted to show you all the spacers, which are very useful so that I know sometimes hands ऐसे हो जाते हैं. Okay, but what happens if there's an ulcer or something, you all will have to put some, a spacer here so that the ulcer doesn't bend, okay, doesn't go together. And that is a finger pose. Okay. These are stretches. You all want to take a picture, you all can, but please don't share it in common places. They are going to come up on my Instagram as well, so you all can take a look over there as well. Stretching of the entire body is very important so that your joints are flexible. Just don't think कि आपका सिर्फ हाथ यूज हो रहा है, हाथ पे अफेक्शन आ रहा है तो हाथ पे काम करना होता है. No, it's head to toe that you all should do. Yoga pranayam जैसे करते हैं वैसे stretching very important. You all can tell your yoga teachers also to teach you all how to stretch and do it. All those who have systemic sclerosis के वजह से affection in the tummy and abdomen and all the internal organs, I am very sure that things get tough and tight all around. Stretching helps keeping the mobility of the skin, and the internal organs also are connected with fascia, which are connected to the skin. So, in all, you're trying to push the stretches inside to your organs as well. This is forearm stretch, front and back. Do you see the arm stretch? There's a balan. There's a rolling pin behind which you can use to hold if your hand doesn't reach. Right? This stretches the front area of your hand. Back thigh stretch. I'm doing it on the floor, the wall support stretch. Okay, but you all can do it over your bed as well. Just lie ulta on your bed with your feet on the wall. So you'll be able to stretch your thighs as well. Anyone who has high blood pressure, please don't do it. Okay, there's chest stretch, which you can do on the wall. All these are not very difficult ones. You can do it in standing position. I'm giving positions which you can sit also and stand also. Next, you see the wedge, that is for calf stretch, wall support, leg stretch. Okay, stretching is very, very important, and they did do a lot of research on it on mice as well and on humans as well. And daily stretching produces beneficial effect. It reduces skin thickness, okay, and improves mobility during fibrotic phase. This is on mice. It reduces mechanical effect. Okay, so there's more mobility of subcutaneous tissue. There's another one which happened in Japan. These are my pictures where I'm stretching the web spaces. Okay, but the actual article does say that stretching of fingers and hands increases the PROM in limited and systemic sclerosis. The third article is Raynaud's phenomena. Over here, they put heated pack over here, or just above the arm over here, heated pack. Okay, and it did give an effect for Raynaud's phenomena. 2 weeks of warmers and 2 weeks of non-warmers were done twice, like repeated twice, and there were statistically significant results. So frequency and total duration of Raynaud's phenomena in warmer application was significantly lower. That means warmers were used and it was helpful. They were warming the upper area above the elbow. That was increasing the circulation to the hand, and thus the effect रेनॉल्ड्स में कैसे होता है कोल्ड एक्सपोजर में कि आगे का पूरा ऐसा सुन हो जाता है, इट बिकम्स वाइट, द सर्कुलेशन रिड्यूसेस, राइट. This helps. It improves the circulation, the frequency, that means the frequency times the entire month में कितनी बार रेनॉल्ड्स आया होगा, that was lesser. And even the duration, 3-4 दिन रहता था तो अभी 2 दिन रहता है, that was also lesser. Okay, I know all of y'all are warriors, and I'm very proud of y'all. There's lots of courage and strength to you from my side. Thank you.
Hi, ma'am. I have a question. Like those who are not having Raynaud's, I have blackness in my hands. Like it's difficult for me to move my fingers. So can I also use that heating pad over my forearms?
Can you switch on the video, please?
For now, I can't switch it on.
How do I see your hand to suggest anything?
Uh, okay, let me show.
Yeah. Just turn the camera. I don't need to see
I
you. That's
think
fine.
Vinita is
Okay,
asking
okay,
for her
okay.
mother because she is a caregiver. So I think that is
Okay.
the reason.
Okay. But if I see the hand, it'll be better for me to
Yeah, but I
suggest if
think I
that's
think
fine.
her mother is not online, so she is
No
actually
problem.
asking for her mother.
Okay. So if there is blackness, yes, you can use this thing. If there are no ulcers, you can use warm water to improve the circulation. When you dip your hand in warm water, make sure you move your hand and fingers. जितना भी होता है, this is too much. This is too much. I understand. जितना होता है, keep moving it. Okay, and after that, stretch the fingers. So, for example, if your hand is like this, I'd like you all to keep your hand on a surface like this, okay, and with the other hand, press it. Okay, I'm going to turn the camera here so that you all can see this. This is your hand. You press it like this. जितना होता है धीरे धीरे करके press करो. So that will stretch the front of your hands. All right, and the blackness should reduce slowly if you use increased circulation. Also, I'd like to suggest that you massage all around. First start, if the blackness is here, okay, start massage from here. First start from the lighter part of the hand, keep massaging, massaging upwards, all right, and then drain it again, like this downwards. Okay, Vinita? I hope I was able to
Yes,
answer your
ma'am.
question.
Yes. Thank you so much.
There are certain questions in the chat box. Shreya, if you could just take it up, please.
Ma'am, I have a question.
Please go ahead.
Can I use socks throughout the night, like for my feet while sleeping?
Do you get Raynaud's? Or
Yeah, yeah, a bit.
you can.
I can. Yeah.
You can. Okay, just make sure that it's when try it once and see whether there is moisture blocking between the toes. Okay, we don't want moisture blocking because moisture is it's like it's not good. It's evil, right? So make sure your feet are wiped, cleaned with nice warm water and nicely cleaned with soap. Dry it completely and then use socks. Okay, I haven't researched about warmers for feet. You can please try checking that.
Okay. Thank
All
you.
right, yeah, no problem.
Mona, please take your question. Mona, please unmute yourself.
Okay. Dr. Shreya, I've
Yes.
got I get lot of ulcers on the feet actually. So a main problem is this that as soon as my feet gets rubbed with the chappal straps, mostly on the upper part.
The numbness
So they,
starts on the upper part.
yeah,
Okay, and you get ulcers up or down?
mostly up.
Mostly up. Okay, and when you wear chappals, is what you said, right?
I wear V-shaped chappals because other like band wala chappals I'm not able to wear at all because I get scratches and then they get transformed into ulcers.
Okay, and are your ulcers open or are they covered? Like, are they dried or are they active right now?
Active, but I have like bandaged them, so I won't be able to show them to you.
No, that's okay. But they're bandaged, right? They're covered.
Yes,
Okay. So is it possible that in those covered ulcers you wear a very thin layer of sock? Okay. And then try wearing a footwear.
okay.
I'm talking to Mona, right?
Yeah, that's right. This is me.
Yeah. I understood that. Mona, what I'm trying to understand is it is possible that the friction from the chappal, the V-shaped chappal also causes
Mm,
friction in the feet. All right.
that's right.
So I have
Mm,
this one slide where I've mentioned that if it's open ulcers, you first bandage them, okay, and put
mm,
warm compress. आपको जितना tolerate होता है उतना warm compress,
okay,
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 around the ulcer massage. So if
okay.
this is the ulcer area, you massage around it. All right. So you're trying to increase the circulation there, right?
Mm.
And then drain it
See,
mildly.
that's my feet and the ulcers. Two fingers have got them.
Yeah, I understand. So uske aju baju, just massage it. Okay. And
Okay,
Mona, there's one more suggestion. The ulcer
okay,
is to be treated by the doctor. The prevention of ulcer, it is on us. let's
Hmm.
try to improve the circulation in the feet. If you have a helper or if you can reach by yourself to your feet, okay, let someone massage it. So take 2 3 fingers, press on it and गोल 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 वो हो जाता है. उसके बाद drain it towards your ankle. Okay, it should go towards
Okay.
your heart. Okay, and
Okay.
do not elevate your feet. Elevation
Hmm.
causes reduction in circulation.
Right.
Elevation above the heart causes reduction in circulation, but keeping it straight
Okay.
legged is fine. You can keep it
Hmm.
straight legged. Also, even with ulcers, if you can move the other joints, that would be
Hmm.
beneficial for you. If
That
you
I
can't
keep on
move
doing.
it, yeah, there
Hmm.
was this one slide. If you can't move it, someone else needs to do something. You see this web space stretch which I've kept open in the article, in the PPT, where
Hmm.
I've,
Hmm.
I've pulled my toes apart. Okay,
Hmm.
if your toes are apart only, you don't have to pull it. Okay, but if they are together,
They are together.
you move the web space a little bit. Okay, तो वहाँ पे circulation आता है. Then there's something called as passive range of motion, where you hold your feet. Okay, this is going to be very weird, but I'm sorry, I'm going to show you all my feet. All right, I'm not sure whether you all can see it. Can you see the feet? Right?
Yes.
So you hold one hand and you hold the other hand. These are long bones in the feet. These are short, okay? But these
Hmm.
are long bones over here. उसको पकड़ने का और उसको ऊपर नीचे करने का. This is passive
Okay.
range of motion. Your physio should teach you over there, and then you can do it
Okay.
by yourself. So when you do
Hmm.
range of motion of the feet, okay, you are improving the movement. वरना क्या होता है, आपको एक जगह पे अल्सर हुआ है, you will not move the foot overall. You will be
Hmm.
like नहीं नहीं अभी नहीं हिलाना है. So stagnation of blood हुआ. अगर stagnation हुआ, skin thicken हुआ, callosity हुआ, वापस अल्सर का चांस हो गया. एक हील होगा और दूसरा आएगा. Right?
Hmm.
So take care of the ulcer, but do take care of your other foot as well while doing it.
Okay.
Right? Also in the
Yeah.
footwear part, if you can meet an orthotic or try the diabetic footwear where they have soft sole and they have soft
Actually,
straps.
soul is not the issue. My issue
I
is
know
on the
straps,
upper part.
they have
So,
soft straps as well, because diabetic
okay.
people, if they have one scratch also anywhere, they get an ulcer which doesn't heal. Okay, so their shoes and all are soft enough and with a material which are less resistant to the skin. Please try it once.
Okay. One more thing I wanted to ask. You mentioned sprints for the hand, but now my toes are also, one is they are getting close to each other, and the other is they are getting deformed like that. So,
Right.
how can I keep them straight so that
There
they
are
don't get
there
deformed?
there are splints for toes as well. All right.
Okay.
But आपका जो ऐसे होता है ना, what you do is if you're able to bend your leg towards the other on your other knee. I'm sorry for y'all being able to see my knee. I don't know whether y'all can. I'm just
Hmm.
trying to give y'all a look. So this is like this. Okay.
Hmm.
ये ऐसे पकड़ के फिर fingers को straight करने का. What I'm doing is I'm straightening the fingers like this and hold it.
Okay.
If you're able to get your leg up towards yourself, hold the fingers
Hmm.
straight. Hold it for some time. Understood?
Okay.
Yeah. And there are buddy straps, but I wouldn't suggest buddy straps to you right now
And
because you
how about
already
to
have.
increase the spacing in them because I'm not able to reach my feet. So pulling
some
the toes
someone
apart are
else someone
difficult.
else can try doing it.
You
Someone
can
else can
also
try.
parallelly, press it against a wall. If you
Well,
cannot do
you
that,
can definitely you can.
yeah, you
There's
can
this
press
picture
it
over
against
here.
the wall, Mona.
Okay.
Against a
This one.
wall, against a cupboard, जहाँ पे भी comfortable लगता है ना. Start pushing your
Hmm.
feet towards any hard surface.
See the
Hmm.
picture on the left, please. There's calf stretch written. You see the wall and the toes going straight up. You can try doing
Yeah.
that. Yeah.
Okay. Okay.
Okay.
And
Dharini,
Dharini. Yeah.
Dharini, can you please take your question?
हेलो। मैं जब नीचे बैठती हूँ ना फ्लोर पे पलाठी लगा के अपन बैठते
Hmm.
हैं तो तब पूरा पैर सुन्न हो जाता है, नम हो जाता है, तो उसके लिए कोई एक्सरसाइज आप बता सकते हो?
Do you think that sun hona and numbness is it in your entire leg from your knee downwards or only one side of your leg?
नहीं, पूरे पैर में धीरे धीरे करके हो जाता है।
पहले मूंगी आना चालू होता है।
हाँ, वो
ओके,
एकदम नीचे से होके फिर पूरा पैर हो जाता है।
yeah, so it is possible that a nerve is getting compressed. Okay,
ओके।
the nerve can get compressed. आप बेंड फॉरवर्ड करते हो तो भी आपको ऐसे होता है क्या?
नहीं, जब मैं नीचे बैठती हूँ ना, और
हाँ,
तभी होता है ये दिक्कत।
okay, so it is possible that a nerve in your buttock is getting compressed because of which ऐसे हो रहा है, because नीचे बैठने में हम
ओके।
ऐसा बैठते हैं. I don't know if you can see my leg
हाँ हाँ।
like this. All right, so ऐसे ना ये बटक स्ट्रेच होता है और यहाँ
हम्म।
पे पीछे से एक नर्व आता है which causes numbness in the legs. You should show a physio, let them get tested for piriformis syndrome. If you want, write it down. A sciatic nerve might be getting compressed somewhere in the journey because of which it is getting numbness. Otherwise आपको numbness नहीं आता ना, नीचे बैठने पे ही आता है ना.
हाँ, तभी आता है। हाँ
Yeah, it is mostly this. Get it checked. If you sit like this figure of four man, you take your knee towards your buttock,
हाँ
ऐसा towards your
हाँ
chest, your buttock की यहाँ पे अभी numbness आ रहा होगा, यहाँ पे दुख रहा होगा,
हाँ,
यहाँ
थोड़ा।
पे
हाँ
stretch pain आ रहा
हाँ।
होगा, आ रहा है
हम्म।
बम के वहां
हाँ
पे. So
हाँ।
that is that. ये पोजीशन में आप उसको थोड़ा थोड़ा स्ट्रेच करेंगे ना 10 seconds 3 times, उससे भी कम हो जाना चाहिए.
ओके, क्या नाम बोला आपने फिजियो को?
Piriformis syndrome. Piriformis.
ओके।
Also, Shreya, would a butterfly stretch be good for this?
No.
No. Okay.
Okay, 1 second. I have Mohammed Faraz. Just give me 1 second to read the messages, please.
Yeah, yeah.
Is Mohammed Faraz here?
जी जी मैडम, हेलो।
हाँ, मुझे एक बार बता पाएंगे आप क्या मैसेज में लिखना चाह रहे थे?
वो मैडम, वो कि जब जैसे स्ट्रेचिंग वगैरह करते हैं तो उस वक्त मसल्स ये हो जाती है, मुझे मतलब नमनेस हो जाती है, और कभी कभी ऐसा लगता है कि एक वेन में दूसरे वेन मतलब अकड़ गई हो, जिसकी
चढ़
वजह से
जाता
मुझे
है.
वापस। हाँ हाँ हाँ।
या तो कभी क्या होता है, अगर आप बहुत जोर से करते हैं ना, तो
जी
मसल
जी
ऐसा टक पकड़ जाता है.
जी
वो
जी।
खुलने का आप ट्राई करें. ये देखो, ये मसल है, ठीक है, ये
हम्म
नॉर्मल
हम्म
मसल है, ये
हम्म,
टाइट मसल है और ये लूज है, ठीक है.
जी
तो नॉर्मल से जब आप उसको लूज कर रहे हैं ना, आप अगर इसे झटके से करोगे ना, तो क्या होगा,
जी।
वो पकड़ जाएगी, वरना वो फट जाएगी ना. तो आप ट्राई
हम्म
करो नेक्स्ट टाइम जब आप स्ट्रेचिंग करते हो ना, तो धीरे से करो. ओके,
हम्म
मुंह से सांस छोड़ते जाओ, 10 सेकंड के बाद धीरे से उसको छोड़ दो, ठीक है.
हम्म,
तो वो ऐसा झटका नहीं आएगा. वो कैच बोल रहे हैं आप, जो झटका आता है ना, फिर वो एक के ऊपर एक
जी
नस चढ़ जाती है, फिर हिलना
जी
नहीं जाता है.
जी जी
वो
जी
मत,
जी।
एकदम धीरे से स्ट्रेच करो. प्रोलॉन्ग्ड स्ट्रेच मतलब ज्यादा टाइम तक स्ट्रेच करो, लेकिन झटके से नहीं. ओके,
झटके से नहीं।
हल्का सा स्ट्रेच आना चाहिए. फिर 10 दिन करोगे ना, तो वो हल्का वाला लेवल आपको इजी लगेगा. उसके बाद थोड़ा और हल्का आगे स्ट्रेच करो. एक
हम्म,
साथ में पूरा मत कर लो,
जी
ठीक
जी
है.
जी,
ओके,
ठीक है। थैंक
अशोका, आर यू हियर?
Yes,
Yeah. Ashoka,
yes, sir.
to increase lung capacity, which exercise are
Yes,
more effective? You said,
mm,
right? Lung
yes.
capacity अलग-अलग ways में increase हो सकती है. Uh, so there's some noise
I
behind
have
which,
ILD. I have ILD.
yeah, I figured that. There's some noise behind. All right. For lung capacity, there are different types of breathing exercises which are done. A physio will teach that. I can't cover everything, but I'll give you an example. This is diaphragmatic breathing, where you take a deep breath from your nose and blow area, get area over here. Okay, यहाँ पे हाथ के नीचे हवा भरने का ट्राई करो, फिर फूंक मार के पूरा हवा निकालो. There's apical breathing, there's lateral costal breathing. Okay, ये सारे breathing techniques समझ के लेने होते हैं, like 1 to 1 इसमें. There's incentive spirometer जिसका मैंने picture डाला है. I am not sure whether you were here that time. Let me just get back. The spirometer works beautifully for ILD. All right. Walking is a beautiful exercise as well because walking improves the heart and lung capacity. अगर आप ऑक्सीजन O2 लगा के नेजल थ्रॉन्ग्स के साथ चलते हो तो भी चलता है, उसके बिना करते सकते हो तो भी चलता है, but walking, cycling is very good. They improve your lung capacity. I'm sorry, give me like 1 second to go back. Yeah. Do you see this picture where did I go like too much back? Okay. Do you see the center picture where there are like three balls? And that is called incentive spirometer. There are varieties of it where you have to take a deep breath slowly inside and slowly the ball will come up. It gives you a visual measure of how much you're able to breathe in and breathe out. तो डेली करना है, 15 से 20 रेपिटेशन करना है, 3 करने का फिर रुक जाने का, 3 करने का रुक जाने का, वैसे 15 से 20 दिन में 2 बारी. ठीक है. सो सी के पहले फर्स्ट डे सिर्फ येलो बॉल ऊपर आ रहा है, फिर सेकेंड डे रेड भी आएगा, थोड़े दिन के बाद थर्ड भी आएगा, वैसा. ठीक है. एंड दिस, ओके, हु इज ड्राइंग ऑन माय स्क्रीन? I don't know how the drawing is happening on my screen. Yeah. The next one is balloon bladder. Thank you so much for clearing it. Balloon bladder है जिससे expiratory capacity improve होता है, बाहर निकालने का. There are other things like ACBT, that is airway clearance breathing technique, which helps in removing cough as well. Okay, there's cupping chest percussion. Chest physiotherapy would be very good for you. All right, so please try getting chest physiotherapy done for yourself. Okay, Ashoka? Dharini, I've already answered your question, right? I do have customized footwear providers in Mumbai, Mona. I will give Rashmi the numbers. You all can ask that. Okay, I think I'm done with the questions over here. Sorry. Okay.
Thank you, Dr. Shreya, for being with us. It was a wonderful session, and I hope, patients, ulcers is something that, most of our patients are troubled by, and because of which, the footwear becomes a very, very big issue for them. So you've
Yeah.
answered a lot of their questions on mobility, on ulcers. I really thank you from the bottom of my heart. Scleroderma India thanks you from everybody's bottom of hearts. Thank you.
You're welcome. Thank you so much for giving me your time and this opportunity. All the very best to you all. You're all warriors. Keep the war on. Thank you,
Thank you.
everyone. Bye
Thank you,
bye.
Scleroderma family. Bye bye.
Bye bye.
Sure, I will give you the recording. I will provide